Catherine, I'm a PA student at Westfield State, and today we're going to be doing a digital rectal exam on our model. So if you just watched my previous video on the genitourinary exam, that was the first portion and this is the second portion. So at this point I've already introduced myself to my patient and I've consented them on the exam. So now I will have them reposition. So I will put on new clean gloves. I will have them reposition. We either can have them lay on their left side with one leg up or standing in a way that they are bent over the exam table, which is the way that this model is currently positioned. So I'm just going to let them know we're going to begin your digital rectal exam now. So to start, first we're going to examine the perianal and coccygeal area by spreading the buttocks, looking for any lesions, looking for any signs of infection or anything out of the ordinary. Then I'm going to have the patient bear down so I can look for any hemorrhoids that might be coming out. And now I'm going to prepare for the insertion of the finger for the digital rectal exam portion. So I'm going to lubricate my pointer finger on my dominant hand. I'm going to place my finger on the anus and I'm going to let them know I'm going to insert my finger. So please take a deep breath and relax, and then slowly insert my finger. So at this point, I'm going to be checking for sphincter tone, any masses, or any tenderness upon initial insertion. Once I've confirmed that it's okay, I'm going to go ahead and insert my finger all the way in. At this point in time, I am going to move my finger clockwise and counterclockwise to feel all areas of the rectum, looking for any masses, tenderness, induration, or anything out of the ordinary. So on this patient, we're also going to be performing a prostate exam. So I'm going to go ahead and make sure I put my finger in to feel where the prostate is. It should be firm, smooth. I should be able to feel the lateral sides and the median sulcus, checking the size, the symmetry, the smoothness, any tenderness like I mentioned before. I will also have the patient bear down at this point to check for any masses that might be above, so they can come down and hit my finger. And at this point, I'm going to go ahead and let my patient know that the exam is over. So I'm just going to gently remove my finger. I'm going to provide them a towel or a tissue to clean up. And at this point, I'm going to turn around so they can prepare themselves. I'm going to take the finger, look at any stool, color, quantity, amount, and then if I have a WIAC test out to check for fecal blood, I can go ahead and place that down. A blue test would be positive. So I'm going to remove my gloves, making sure that I contain any feces in them and dispose of these properly. Check that my patient is okay, and that is it for your digital rectal exam.